Hi, I'm Jessie Gruman, President of the Center for Advancing Health. Some days I'm really grateful for the internet, and some days I think it's part of a plot designed to shift work onto me. This morning I read about a networked wireless pillbox that prompts people with chronic kidney disease to take their medication. This box not only reminds the person to take her drugs, it also lets her caregivers and her doctors know when she doesn't. Sounds a little bit like Big Brother in a bottle, but no matter. If people are to benefit from their treatment, they have to choreograph the ingestion of many pills at prescribed intervals throughout the day, and these program nudges can apparently help them do this. So then I read that Medline Plus is now available for use on my cell phone, so I can look up the generic equivalents of my prescriptions while I'm standing in the drugstore. Is that cool or what? Every day I hear about 6 or 7 new ways that I can use the internet through my computer or my phone to learn about the drugs I now take or I might take, the doctors I now consult or those I might consult, the symptoms I now have and the diseases they might signify, plus much, much more. The web is so tempting and responsive that it's easy to spend hours trying to figure out, what's that ringing in my ear? Is there something I can do about it? And which of my many doctors should I call? I feel compelled to make use of health tools online. After all, there are sites that allow me to self-diagnose the symptom that troubles me right now, and a few minutes of searching on the web is far more convenient and far less expensive than a trip to the doctor. But the availability of online health tools raises new questions about changing expectations of our participation in our care. If all this information and these tools are available online, to what extent am I responsible for using them? Our employers certainly expect us to do this when choosing providers and a health plan if we're so fortunate as to have a choice. The government expects us to use them. You can't possibly choose a Part D pharmacy plan without going online, for example. Some health plans expect it. The member portion of the health record allows their members to schedule vaccinations and mammograms, refill prescriptions, and make appointments. Now, arranging for us to do these chores online automatically eases the sponsor's administrative burden, and they work fine for me as long as I'm relatively healthy. But what are the limitations of the expectations for my online participation? Will my employer, the government, and my health plan also make arrangements so that I am not disadvantaged by my lack of online participation? That is, if I don't have the equipment, the time, the experience, or the clear head to do these online chores, will I still receive decent, timely care? Research on the digital divide tells a story about growing access to the internet and increasing health-related searches. But that research doesn't do justice to describing just what's at stake here. The growing requirement that we manage parts of our healthcare online and the risks that accrue to us when we are ill or otherwise unable to do so.